Hi, good afternoon. Can we meet you?
Hi, my name is George, and I'm currently working as an HR officer at an NGO.
So, George, I wanted to ask, when was the last time you were in a hospital?
I think my last visit to hospital was about a year ago. I had been having palpitations, heart palpitations, and eventually, I think it turned out that I had HBP. So yeah, at least at the time. But yeah, that was the last time I had visited the hospital.
HBP being.
High blood pressure.
So, what was that experience like? How was it interacting with the healthcare system?
I think it was just there. So I had visited a primary healthcare center at a job, and I think there was just a waiting area, and then vital signs were checked, and then I had to wait to see a doctor, examine my blood pressure, and then I was advised to rest for a week, and I took some injections and was given some drugs.
How much did this visit cost you?
It cost me a lot too. Not that one, no. On my intense salary, it cost me a lot.
Could you afford it?
I couldn't. Fortunately enough for me, the NGO that I work in, my MD had transferred some funds to me, telling me to go to the hospital.
Do you have health insurance?
Yes, I presently have health insurance.
Have you used it?
Yes, for dental care.
Do you trust the Nigerian healthcare system?
No, and yes.
Why?
But more of no. So no, because I think to a very large extent, I think the healthcare system is, or at least the private healthcare system, even the public one, feels more profit-based.
If you could fix one thing in the healthcare system, what would it be?
The Nigerian government.
How?
Okay, I wouldn't say the Nigerian government, I'll say the Nigerian factor.
What's the Nigerian factor?
I don't know. Not enough drugs, not enough healthcare professionals. What else again? Not enough, will I say, medical equipment to facilitate treating, individuals that are not feeling too well. So yeah.
Has the healthcare system ever failed you?
I'd like to think yes, the healthcare system has failed me.
When?
So I think so in 2014, my dad had been battling a couple of health issues, and then he had become terribly ill from traveling. And so we had visited the hospital, just gave him a couple of drugs. He came back home. 3 days later, we had to go back to the hospital, and he just offered him a bed. And let's just say by the next day, my dad had, briefly left his body, and then there was no defibrillator. That defibrillator wasn't there to jerk him up, and from there, call to glory.
So you think there's something they could have done that would have made a difference?
The doctor wasn't around, so I think maybe the availability of a doctor at the time could have maybe managed the situation better.